I bring you greetings on behalf of the over 23,000 members who are Local 79 members who work for Bridgepoint Hospital, Toronto Community Housing, and the City of Toronto. Local 79 is also represents thousands of healthcare workers at Bridgepoint Hospital, Toronto Public Health, City of Toronto's Long-Term Care Division, and emergency medical dispatchers in Toronto Paramedic Services. It is with a great weight of history upon my shoulders as I speak to you now. The City of Toronto, and Local 79 members specifically, all remember the fear, distress, and sacrifice made by the workers in Toronto Public Health. It is with considerable concern that I address you in the hope and prayer that history does not repeat itself. Toronto Public Health is a leader, not just in our province or in our country, but worldwide. It is the pinnacle of public service and serves as a model of preventative health. The 2003 SARS epidemic is a remarkable demonstration of what can happen when the city fires on all cylinders. In 2003, when the eyes of the world were upon our great city, it was Torontonians and healthcare workers who stood up and answered the call. It was Toronto Public Health members who received over 300,000 calls to the SARS hotline, calming and educating Torontonians. It was Toronto Public Health that helped identify over 23,000 people and put over 13,000 into quarantine. And sadly, it was healthcare workers who bore the brunt of caring for our sick and vulnerable. And one of our members, Nelia Laroza, unfortunately contracted the virus while working at North York General Hospital. Our thoughts are with her family today. Sister Laroza and Toronto's healthcare and public health workers were heroes during the SARS crisis. And it is with those sisters and brothers in mind that Local 79 stands unequivocally opposed to the Ford government's plan to gut Toronto Public Health. We know Toronto Public Health is the backbone of our entire healthcare system. Public health workers monitor infectious disease, test water quality, provide a safe place to inject intravenous drugs, make sure kids in schools get a healthy meal, and ensure our food is safe to eat at Toronto's many restaurants. The Ford government's plan to cut their funding by $1 billion in the next 10 years is reckless, cruel, and will result in the deaths of our fellow citizens. This is unacceptable. Today, we recommit to protecting our public health system and Toronto Public Health in particular. We also recommit to ensuring that our frontline healthcare workers are protected in their workplaces. No worker should have to risk their lives to save another, and every worker should expect a safe workplace. We ask you for a moment of silence. Thank you.